This is about a severe medical condition and complication of malaria which affects the urine. Blackwater fever. Blackwater fever, that is a serious complication of malignant tertiary malaria. And there happens that the person has jaundice and also the discoloration of the urine to black and dark gray and severe kidney failure. As treatment is been listed in the book that there are alkaline fluids and bicarbonate soda and intravenous glucose drip. And there is a suspicion that it might be from quinine, which is used to treat malaria, and then this quinine should be stopped to be given. But it's said here that the exact cause is not exactly known where it comes from. And it can be necessary to give a patient a kidney machine because of a kidney failure. And this is according to the Family Medical Advisor book by Keith Hodgkins, written in the 1970s on the page 91. And this is no medical advice.
Hi, Rebecca. I'm trying to learn medicine. Today, Blackwater fever, and after we've done it, we're gonna do stretching. And if you participate in the stretching medicine at your own risk, then we're gonna talk about internal anatomy, the blood system, the blood disease, and so on. And this is no medical advice. I'm just trying to read it and I try to understand it. We're going to go over the text and I try to memorize what is written here. So Blackwater fever, that is the second time that we're reading it actually. A serious complication of malignant tertiary malaria, in which the red blood cells are destroyed. The disease gets its name from the color of the patient's urine, which turns dark. So we're going to talk also about urine. Okay, it is a complication of malignant tertiary malaria, and the red blood cells are destroyed, and the urine is turning dark. Let's take one look at malaria. One of the most widespread and serious infectious diseases in the world, written in the 70s. Since 1956, the World Health Organization has been sponsoring a program to eradicate it, but malaria remains difficult to control. And the number of cases coming into Britain, it is a British book, into Britain each year is increasing. There are three major types of malaria: malignant, tertiary, benign tertiary, and quartan. They are caused by different species of malarial parasites which are carried by mosquitoes. Infection is transmitted to men, so men and women, humans, by a bite from the female mosquito. Symptoms: fever that peaks every third or fourth day, headache, muscle pain, bouts of fever with shivering attacks. Incubation: malignant and tertiary, 14 days, quartan 18 to 6 weeks. Duration: malignant tertiary, with prompt treatment, recovery occurs in a few days, although convalescence will probably be necessary. Without adequate treatment, infection persists and serious complications can arise. Benign tertiary: after about a week, the fever and shivering attacks begin to occur irregularly every other day. Without treatment, the infection persists, but it is rarely fatal. Quartan: fever and shivering attacks occur every third day and tend to be regular. Although quartan malaria is more disabling than benign tertiary malaria, it is responsible to treatment. Causes of malaria parasite. Let's read it for a moment. Signal for the mosquito: the air surrounding the human body is constantly moving, sending up a turbulent plum of warm, moist air currents above the head. The mosquito, first attracted by a rise in the level of carbon dioxide in the area, zooms in on the moist air currents and attacks its victim. Seeing air. This picture, taken by a special photographic method called the Schlieren system, shows the air moving around the body. I'm not going to show it right now. Complications. The only type likely to cause complication is malignant tertiary malaria. But that is what we're talking about. Without prompt treatment, anemia and shock can affect the brain or the lungs and kidneys. See Blackwater fever, and death may follow. So anemia, that is not enough red blood cells, not enough hemoglobin, and that was the Blackwater fever. The red blood cells are getting destroyed. Without prompt treatment, anemia and shock can affect the brain or the lungs and kidneys. Blackwater fever. Keep the patient warm with rest and plenty of drinks. Immediately consult the doctor, even if it is months after visiting a country that has the disease. What the doctor might do: prescribe chloroquine or another anti-malaria drug. Prevention. Travelers to at-risk areas should protect themselves by taking chloroquine and other anti-malarial drugs from 1 week before arriving in the area until 28 days after leaving it. In certain areas of the world, malignant tertiary malaria is not prevented by chloroquine. Seek advice from your doctor, travel agent, or employer about appropriate drugs. With modern drugs, the outlook is good, and chronic relapsing malaria should not occur. Okay, what is malaria? It's something spread by a mosquito. We're not going to say it in our presentation about Blackwater fever. We're just going to say it is caused by, as a complication of malignant tertiary malaria. The red blood cells are getting destroyed. Symptoms: jaundice. I have no idea what it is. Jaundice, also black or very dark urine, and there may be severe kidney failure. Duration: a day or two if the attack is mild. Causes: the exact cause is unknown, but Blackwater fever may be due to the quinine used in treating malaria, since it occurs in people taking the drug. So the first important thing: cause is unknown. So maybe we're going to stay completely away from saying the cause and just say nothing. But Blackwater fever may be due to the quinine used in treating malaria, since it occurs in people taking the drug. Maybe we're going to say it. Treatment: absolute rest and careful nursing are essential to ensure recovery. So rest. If there is kidney failure, the patient may need treatment with a kidney machine. Plenty of alkaline fluids should be given, and the patient may need an intravenous drip of glucose and sometimes bicarbonate of soda. A blood transfusion may be necessary. Treatment with quinine should be stopped. This is now medical advice, what we're doing right now, and also the video we want to shoot. So we're going to stay a little bit away from it, but I think we're going to mention it a little bit. There is a suspicion that it might be from quinine, which is used to treat malaria. And basically that. But the cause is more or less unknown. If someone is treated with quinine, it should be stopped. It might be necessary to do blood transfusions. Also alkaline fluids and alkaline fluids, glucose drip, intravenous glucose drip, and bicarbonate of soda. Glucose, intravenous glucose drip, bicarbonate soda, and alkaline fluids. Maybe also because of failure of a kidney, treating with a kidney machine necessary. Resting. Cause unknown, it could be quinine. It is jaundice, whatever that means. The symptoms: jaundice, black and dark urine, and severe kidney failure. It is a complication of malignant tertiary malaria. I'm going to stop the camera and try to start it. We're having a little technical problem. Okay, but it was bicarbonate soda and intravenous glucose drip and alkaline fluids. Jaundice, quinine. I want to say a little bit at the beginning as well. This is about a severe complication of malaria affecting the urine. Blackwater fever. By Blackwater fever, it's named because the urine of a patient turns dark grey or black. Now, it is a complication of malignant tertiary malaria, and the patient has jaundice, and then also with discoloration of the urine, and the patient should rest. And now, as treatment is when here listed alkaline fluids and intravenous glucose drip and bicarbonate soda. And there is a suspicion that it is from quinine, which is used to treat malaria, but it is said here that the exact cause is not known. And the book is from the 70s. And this is now a medical advisor. But first, the other thing, the book is written by Keith Hodkins, and it is called The Family Medical Advisor. And this is the medical advice on the page 91. No, it was a little bit mixed up. And I forgot the thing. I wanted to know what it was, please. The kidney failure. We have to say, but we're going to do it again. I don't like my warning. This is about a severe medical condition and complication of malaria which affects the urine. Blackwater fever. Blackwater fever, that is a serious complication of malignant tertiary malaria. And there happens that the person has jaundice and also the discoloration of the urine to black and dark grey and severe kidney failure. As treatment is listed in that book that there are alkaline fluids and bicarbonate soda and intravenous glucose drip. And there is a suspicion that it might be from quinine, which is used to treat malaria, and then this quinine should be stopped to be given. But it's said here that the exact cause is not exactly known where it comes from, and it can be necessary to give the patient a kidney machine because of a kidney failure. And this is according to the Family Medical Advisor book by Keith Hodkins, written in the 1970s, on the page 91. And this is no medical advice. Still not completely straight, but a little bit better. I'm going to speak him. It was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We're going to do the next thing. If you stay here and participate in the stretching, then it's with the honest. The feet are standing together, and one foot opens with the toes, the heels, the toes, heels, and so on, as far as you can go. And then again in. Toes, heels. Stay down when you come in. Now, shoulder width wide apart with the legs, breathe in with the arms up. And breathe out, go to the side. In and up. Out to the other side. In and up. Out and down, one hand slides down the leg. Breathe again in. Out one arm over. Breathe in and out the rib cage. Out and back. Again in. Out the other arm slides down, the shoulder stays down. Breathe in. Out one arm over. Breathe in, out the rib cage. Out and back. The feet are standing together. Breathe in, the arms up. And out one arm down. Breathe in, reach. Out. Breathe in, arm down. And out. And up, and down. Shoulder width wide apart with the legs and shoulder circles back, up and front and down. And in front, back and down. And breathe in the shoulders up. And out, let's move fall down again. Again, in. Out. Breathe in the arms up. And reach always with one arm high up. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then to lift it out. And legs wide apart, arms up to T, breathe in. And out, shift over to one side. Again in. Out, over to the other one. Again in. And out and lean onto the knees. Breathe in. Out one arm in front, or one shoulder in front. And back. Out the other shoulder in front. In and back. And out and down. Close the feet again. Breathe in. And out. And breathe in. And out comes slowly with a round back up and make it on the backwards shoulder. Legs apart, arms apart. Breathe in, down. And breathe out. Again in. Out. Breathe in and up again. Hands together and again down. And with position stretching, down the hands. I thank you very much and until next time.